Hi there, my name is Amy France, and I serve as Gordon College's Senior Director of Alumni Engagement. I'm from the class of 2001, and I wanted to welcome all of our students here this evening to join us for our second Alumni Talks. Tonight we're covering health professions, and so we're really excited to share a wonderful group of panelists. Students, I just want to remind everybody that you can get Christian Life and Worship credit. And if you go through the same portal in Canvas as you would to enter chapel credit, you can also receive Christian Life and Worship credit for this event tonight. I'd like to invite all of my panelists to join us for our thing and turn on their videos and unmute their sound as well. Great, thanks everybody. Well, I'm really excited to share with you all who our panelists are with us here this evening. So let me introduce us. So first I have John Beebe. He is a 2006 grad and is currently with is a medical device sales representative from Tornier Wright Medical. John, if you want to say a quick hello.
How's everybody doing?
Thanks. And then I have Joanna Hewitt. She's a 2005 grad, right before John, and she is an executive administrative director for neurosurgery with Boston Children's Hospital. If you want to say a quick hello, Joanna.
Hi, everyone.
Thanks. And then we have Stephanie Rouse, who's a 2011 alum, and she is a field education coordinator with Temple University's College of Public Health.
Thanks so much for having me.
Thank you. And then we have Dooney, who is Dooney Gatena. She's a 2014 alum who is currently a medical student pursuing her PhD at Meharry Medical College.
Hi, everyone.
Thanks so much, everybody. So I'd love to start out. Maybe if Dooney, maybe if you wouldn't mind starting actually for us, would you just mind telling us a little bit more about what you do, what you have done? I know you've had a pretty vast research background in the medical field. And then just what did you study at Gordon? So if you could just give us a quick overview of kind of your Gordon time, what you studied, and then kind of what you've been doing to now.
Sure. So I graduated in 2014, like Amy said. I studied biology, majored in biology, but minored in chemistry. After I graduated from Gordon, I just entered the clinical research world. I worked at Dana-Farber for 2 years, and then I was at Broad Institute for another year before I went to, started medical school. So I'm a third-year medical student pursuing my MD. I wish I could do PhD, but I'm not cut out for that. But yeah, so I did biology and chemistry minor. When I started, I didn't know anything about clinical research. It just happened to be there, and I was looking for a job. So just sort of learned on the job. I don't think your bachelor really prepares you for what the work life is like. It's just really, you need the degree so that you can have the credibility to go and do something. So that was basically what happened for me. I think that's it. Those are your questions. I always forget the questions in the middle.
No, you're great. You're great. Stephanie, would you mind sharing a little bit about both what you studied at Gordon and then sort of what you do now and kind of what you've been doing up until this point?
Yeah, absolutely. So when I was at Gordon, I came in as a psychology major and ended up adding a double major with sociology. And when I was at Gordon, I really was trying to figure out what I wanted to do professionally. So I ended up doing a lot of internships. I was a research assistant with one of the at McLean Hospital. I thought that I wanted to go into clinical research and kind of realized that wasn't the best fit for me because I wanted a little more interaction with other people and not so much crunching numbers. And then when I was a senior, my psychology advisor knew that I was starting to get interested in public health, which was less of a pop culture field at that time, and told me that the city of Peabody, not too far away, was looking for someone to do some part-time consulting work in public health. So I took that opportunity and kind of ran with it. And after I graduated, I kind of grew my own public health consulting business from there and was doing that full time until I decided to go to grad school at Drexel University in Philly, where I live now. And after I finished my master's of public health, I did a couple different case management jobs and then realized I actually really do like to be in more of an administrative role and not so much direct care of clients. And so I've transitioned to working in higher ed administration at the College of Public Health at Temple University and really like it.
Awesome. Thank you so much, Stephanie. Joanna, would you mind sharing the same information?
Sure. So I graduated with a dual major in social work and sociology. So I specifically went to Gordon because I wanted to study social work. I knew that I wanted to go into a helping profession. I was pretty clear about that. And at the time, I think healthcare administration, that degree was just starting out. I think Stonehill was one of the few colleges that was offering it at the time. And at that point, your choices were either to go into social work, or psychology, or some kind of clinical profession. So I decided to pursue social work, and I've been at Children's since I graduated Gordon, so I've been there for 15 years now. I decided to just get my foot in the door. I took an entry-level position in the fall, right after graduating in the spring, with the intent of just learning more about the institution. I knew that I wanted to do some kind of pediatric social work, so I thought it would be a great way to get my foot in the door, build a network, and my plan was to go to Simmons to get my master's degree in social work, but my interests actually ended up lying within process improvement and operations in healthcare. So I realized that there was so much that could be done in that space to help patients and to help our providers by removing barriers for our patients and a lot of the administrative work that was falling onto our clinicians. So I didn't know it at the time, but I was doing a lot of process improvement, a lot of Lean Six Sigma work. I would just go to my boss and say, I have an idea about how to make this front desk process a little bit easier, or our phone tree a little bit easier. And he was such a champion of my career. And I just fell in love with it. I fell in love with the management of the healthcare industry and felt that my skill set was suited to that. And I went back and got my master's at Emmanuel while I was in my early career at Children's. But I did take a couple years to figure out what I wanted to do and what I definitely didn't want to do, which I think is equally important. And that led me along a very robust and wonderful career track within Children's. I had my first supervisory position a couple years in, and now I'm, in the intro, I'm the executive director for the Department of Neurosurgery. So I had a lot of people who have helped my career along the way, and I just kind of kept moving towards that love of operations improvement.
Thank you so much. John, would you mind sharing also what you did at Gordon to study, and then just kind of what has gotten you to where you are now?
Absolutely. So I graduated in 2006, and while I was at Gordon, I studied business administration and really just chose it because I had no clue what I wanted to do. Maybe like some of you when you entered. So I studied business. I also played basketball while there. And honestly, the biggest thing it did is I just built connections, most of them unintentional. It was not a networking type thing I was really intentional about. But once I graduated, I, through a buddy of mine, landed in a defense industry contract, like consulting company, right outside Boston. Was there for about a year and a half, and then my wife, who also graduated from Gordon, was from the Pennsylvania area and said, I'm going to grad school in Pennsylvania. So I said, okay, let's go. So I did some tax accounting work in Pennsylvania, again, really not having a real idea of my career. And then through some other conversations and relationships, fell into the world of medical device sales and have loved it ever since. It's a completely hidden world of being in the operating room with surgeons, interacting with surgeons, interacting with nurses, interacting with administration, and really getting to make an impact on a whole other side of things in patients' lives. So I've been in a bunch of different specialties, but most of my career has been primarily in orthopedics, ranging across the whole specialty. Right now, I'm in total joint replacement.
Awesome. Great. Thank you so much. I'm loving the panel and the panelists. I hope the students are too, because each person here is in such a different portion of the medical field. So I hope, you know, as our students are thinking and taking things in, we'd love students for you to be sending in questions. We're going to keep going through some questions that I have for the panelists. And then I'd be glad to share your questions that you may have for each person as well. So feel free to use the Q&A function to be sending in some of those throughout this time. I would love to hear, and maybe we'll go back straight through kind of the same way we came. John, I'd love to hear from you. What do you feel like you were doing during your college years to start making yourself career ready? Even if it wasn't knowing where you would be right now, but what were some of those things that you feel like you were taking advantage of or thinking about during your time?
This may go against the grain a little bit, but I really just tried to live life. I mean, you know, studies were really important, but I tried to get involved, obviously with the basketball team. I did O Crew. Part of that was also chasing after my wife at the time. So it was really just taking advantage of opportunities and trying to build relationships with the people that I came across. And like I said, I wish I could take credit for having foresight into how that would play itself out. But really, it was just a little bit, I guess, kind of God's calling for me, just the way he built me, the way my personality kind of fit in with those different segments that really kind of prepared me for life after college.
Thanks. What about for you, Joanna? What were things that you were doing that at the time you thought were preparing you well?
Yeah, I'm going to go along the same lines as John and say, I don't know if it was very intentional. I think relationship building is such a great skill set to have that will serve you well wherever you go. So I think for me, it was a lot of just trying to meet people, and I think just having a spirit of curiosity about learning what makes people tick. I love the interpersonal dynamics between different groups and people. So really just trying to be present. And of course, I'm a little bit type A, so I think I was very heavily involved in my studies. But I think for me, it was just about building those relationships and those interpersonal skills, which I think are very critically important and sometimes undervalued when you get into I'll put in quotes, the real world. But being able to, for me, to be able to talk to a physician, you know, on the first day of my job, or be able to go to my administrator, or to be able to just connect with my peers, I think has served me well in my career. And of course, I manage people now, so trying to pull out the best in people and understand what makes them tick is really a source of pride in my job, because I really love being able to develop the people that I bring onto my team. So I think of just learning how to pay attention and coming at people with a spirit of curiosity and non-judgment are really great skills to learn while you're in college.
Okay. What about for you, Stephanie?
feel like I was maybe the opposite a little bit of the last two folks. I was very intentional about seeking out a lot of professional opportunities like as soon as possible. So when I was at Gordon, there was the Gordon and Lynn program where we would be transported to the city of Lynn and do some different outreach work. And I was interested in education a little bit at the time, so I took that opportunity to start teaching GED classes. And I did that for a little, I think it was 3 years. And that was a really great opportunity for me to have an opportunity with public speaking, get a little more comfortable with that, working with a lot of my students who were not English first language learners, working with really diverse population. And so that really has helped me as I've moved along in my career to just interact with all different types of folks. And like I had mentioned before, I thought I was interested in research and clinical research. So, I spoke with one of the psychology professors at the time and let him know about my interest, and he took me on as a research assistant, and it was a great experience. But like someone else mentioned, it's really important to find out what you don't like to do. And that's one of the ways I found that out through that. And a second internship I had at McLean Hospital doing clinical research, and that really cemented it for me. So that was actually very helpful, and I'd met a lot of great people through those opportunities who've actually impacted my career years later, that even though I didn't go in that direction professionally, they ended up being important in my career as a whole. Beyond that, I just sought out on my own, even outside of Gordon, opportunities that I thought I might be interested in. I was also interested in medicine and health. So I just went on Beverly Hospital's website at the time and saw what volunteer opportunities they had and got plugged in as a volunteer with a group called Connecting Young Moms. And we had a support group for young mothers and provided some different educational opportunities for them. And all of these opportunities really ended up creating who I was as a young public health professional. It gave me a lot of the skills I used early on in my career as a case manager, and also, slowly but surely pushed me to realize I really like to be in an administrative role and kind of more doing paperwork, being in more of a mentorship and supervisory role, which has helped me along now working in higher ed admin. And I still have the opportunity. I manage the undergraduate public health internship program at our College of Public Health, so I do still have that interaction with the students. But I still also have realized that my forte is really sometimes more so in, policies, procedures, and things of that sense. So I think that what was said before is so helpful, being, immersed in, your experience as an undergrad student and making relationships. And then also, if there's something that interests you, now's the time. Seek out an opportunity that, you might be able to flex those muscles.
That's great. Thanks, Stephanie. Judy, what about for you? What were you doing during your time at Gordon to kind of start getting yourself ready?
Yeah, so I think it goes more similar with what Stephanie was talking about. So I knew when I was at Gordon that I really wanted to go to medical school. And I don't know how familiar you guys are about the medical school application process, but it's extremely competitive. So from day one, freshman, I knew that I needed to be aggressive in my approach for internships, and so that I can have the right kinds of recommendation letters and the right kinds of CV to be competitive. So freshman year, I had the opportunity to do internship at Mass Eye, so that was a really good chance. It's like it's a big name. I hated ophthalmology. I thought it was extremely boring, but it didn't matter because the name is there and my CV looks good. But I guess besides that, so every year I tried to do something. Basically, every summer I tried to do something that was going to add some value to my resume. However, I didn't just do stuff that was just there. I guess my freshman year I did, but they did pay me though, so that was good. And I got to live in downtown Boston, so that was good. So there was a plus for it. But yeah, after sophomore year, I took a group of people to Ethiopia. That's where I'm from. We did a medical mission trip, and this is something that I organized as a sophomore. So that was extremely very stretching experience for me, like mentally, emotionally, everything. Probably the hardest thing I've ever done. And junior year, I did like some work at Beverly Hospital. And it's just like everything that I've done when I was at Gordon, it really added more and more value to my CV, but at the same time, it was stuff that I cared about. So that really, really mattered. But, you know, I didn't apply to medical school right away. I took 4 years off after Gordon. So I think there were some things that I've done at Gordon besides just trying to apply to medical school that really helped me to secure jobs that were also really good in Boston. And I think one of the things I would say that I did is like, I've always talked about things that interested me, and I was passionate about stuff. I cared about stuff, and when I'm having conversation with people, it could be about global medicine, it could be about issues that are happening right now, it could be about faith, it could be about racial injustice, it could be literally anything. You could have a conversation with me and you can tell that I'm passionate about it. And so I guess the one thing I would say is like, care about something, because when you are applying for jobs, like for example, Joanna, I'm sure interviews many people, and one thing that I realized is like, I interviewed with 7 physicians when I was trying to get my job at Dana-Farber, and it was very intimidating. I just graduated, I don't know anything, but they didn't ask me a bunch of questions. They just had a conversation with me, and they just wanted to know like what kind of person I was and what do I care about. They knew I didn't know anything about clinical research, but they didn't really care because they just wanted someone who's cared about something and so was passionate, and they're able to talk about it. So I guess like, I would say 2 skills. Number one is definitely I was aggressive in my academics. I was aggressive in my connections, trying to make a good competitive CV for my medical school. But in the flip side, I didn't I was not easily intimidated by people. I would go to Dr. Story's office and would just talk his ear off about whatever topic. I would go and meet with Dan Timon and just have like a conversation with whatever. It's just that people never really intimidated me, and that was important. And when you go to places, people take you seriously when you are able to express yourself and you are not easily intimidated, and you can hold a conversation basically. So I would say those are the things I did. I worked on myself, but I also worked on my CV, if that makes sense. So.
Judy, that's great advice. Thank you so much for sharing that. That's excellent. I do have.
I'll echo that just for anyone who's in the interview process or thinking about interviewing. I always hire for personality over skill set. So a lot of times people get really nervous that they have to, bolster their resume that doesn't have a whole lot on it, and trying to convince me why they have the skill set for the job, when I'm really trying to look at that personal connection and why they're passionate about the role and why they're excited about the role. That to me speaks so much louder than anything that I'm reading on their resume. So just something to tuck in the back of your minds as you're thinking about that. It's so important for me. I can teach the skill set. I can teach someone the job. I can't teach them perseverance, passion, and connection to the work. And so that is always what trumps whatever it is I'm reading on the CV. So I'm glad that that was just brought up, and I wanted to add that as just as someone who hires a lot of people, I always, if I feel that connection, I can feel that enthusiasm, even over the computer for these poor folks who have to interview over a Zoom. You can see it. You can see it in people's eyes. You can see how excited they are. And that to me is a hands down win. So don't fret if you don't have everything or the perfect CV. You just, like was said earlier, just have the passion, personality, and don't be afraid to be yourself, because I think being genuine, you can tell immediately if someone's being genuine or not. So little tips when you get to that phase in your career.
Thank you. That's perfect. We did get a question sent in, which I think will be so interesting to hear from each of you what your take is on this particular question. So the student asked us, how does work in the health sector look like now in the midst of a pandemic and a public health crisis? So maybe Joanna, would you mind kind of kicking us off with a response? And I'd love to hear from each of your sectors of your industry.
Sure. So I will say it looks completely different than it did in January 2020, at least in my world, which is very operations frontline service and very in-person. It was very in-person, appointment driven. So I manage multiple teams, but one of the teams that I manage are the staff that check in patients, that do all the registration. I would say 95 to 99% of the time we were all there in person in the office, and all of that has changed. I do think it's changed for the better, especially at Children's, because Children's had been lagging a bit on their virtual care options. So there was this misconception that we couldn't do virtual visits for children, and the insurances weren't going to pay us, and we can't do this and we can't do that. And I will say we had a very, very aggressive goal to meet a certain number of virtual visit volume, a 5-year plan that we met in 1 month after COVID. So it was insane to see how quickly, and it really was to the cred of our virtual care colleagues and those who were working around the clock to make this happen. We probably went from, I'd say, 100 virtual visits in-house per day to over a couple thousand per day within 4 to 6 weeks. So to me, I think it really helped us push the bar a bit, because patients don't want to drive into Longwood. They don't want to have to navigate that traffic. They don't want to have to take a full day off just to have their kid be assessed for something that's, in most cases pretty manageable at home, or they just had a diagnosis that needs to be looked at. So I would say that was one piece of it that looks very different now, and we're starting to up our in-person volume, but we're hoping to remain at least 30% virtual visits, which I think is a pretty good goal to have. The other thing was managing people virtually, which was a pivot for a lot of managers, including myself. So like I said earlier, I'm a people person. I like the interaction. I feel like if I can sit down with someone and have that a face-to-face talk with them, I can get a lot more out of them. So to stay connected to the teams that I manage was a new skill set for me, especially over Zoom, to keep people inspired and encouraged along the way when they themselves were feeling kind of scared and nervous and uncertain. It was, we tried everything. We did like a trivia night. We did some fun things to just keep people engaged, but also I think the over communicating was a big thing that we needed to learn how to do for our team. A lot of people we hire are right out of college. So, they're either in their first apartment by themselves, or they're at their parents' house or something like that. So keeping them engaged and connected to the work was a challenge, but I think, again, one that actually had some really positive results at the end of the day, because we were able to then prove that most people can be just as productive in a virtual environment than they can be in person. So I'm hoping that also doesn't go fully away, and that we can allow people more flexibility and work-life balance. I live in Beverly, actually very close to Gordon. I was taking the commuter rail every day into Boston, 3 modes of transportation to get to my office, and I felt like I had already lived a day by the time I got there. So I love the fact that I have some of my life back, and the 3 hours that it was taking me to commute every day, I'm actually giving back to Children's because I'm being here and being more productive at home without having to deal with that commute. So a lot of changes in that space, but I think ones that actually will have a benefit in the long run.
Awesome. Thank you. John, I'm wondering if you wouldn't mind kind of taking that question. Just from your perspective in sales, I'd love to hear what your thoughts are on just what it looks like from your angle in the health sector during the crisis.
Yeah, I mean, it's been really interesting. I would agree there have been a lot of changes. Most of my job is about engaging surgeons, trying to drive new business, service current users of our products. So that has taken a whole new spin, and trying to find new ways to do that, because a lot of offices are shut down and not accepting meetings and different appointments. On the other side, once you get to the hospital and to the operating room, there's still changes with, COVID tests and different things, different precautions leading into that. But honestly, once that surgery starts, not much has changed on my end. The surgeon still has a job to do with the surgery, and my job is to support them, the staff, however I can, in terms of guiding the use of our products. And so in that sense, it's been a little bit, it's like, okay, you have to find your way through some new, one direction ways in the hospital. You get scanned going in, there's lots of other kind of protocols in place. But once I'm there in the operating room, it's been kind of business as usual. Show up, be a professional, make sure you're taking care of that patient the best you can and servicing your customers the best way you can.
Great, thank you. Love to ask Junie a specific question to you. What does a day in the life of a medical student look like right now?
Yeah, so I am on my 3rd year now, which means I'm in the clinic. So when all COVID happened, they took us out of clinic. They were like, you are not supposed to be there. We do not have enough PPE for you. You're just a waste of time, a waste of PPE. So go home. It was nice because we were able to actually finally be home. And I was like, oh, my apartment looks nice. So it was good because we had a 4 months off, did virtual and everything. But right now that we're back, I guess I can speak on my experience now. I'm doing family medicine, so it's just all primary care outpatient stuff. We would start seeing patients like 8 in the morning and it goes all the way till 4 p.m. I would see patients, as many patients as I can see throughout the day. And we do have like sometimes lectures embedded throughout the week, or sometimes the program does it like one day you have all day of lectures. And so then we do that. So Wednesdays are for us lecture days. But for the most part, unless I have like inpatient hospital service, I am off on weekends. So that's a time to basically catch up with schoolwork and study and all of that, because we have to take a shelf board exam after each rotation. So I just took peds like last Friday. Yeah, I mean, it's a busy life. I have a very busy schedule, but totally doable.
That's great, thank you. Stephanie, what about for you? What is a day in the life of the work that you're involved in between, overseeing and mentoring different students, to the different types of paperwork and policies that you're working through?
Yeah, I do want to apologize. My internet's saying it's unstable, so I hope everyone can hear me. So I really enjoy being in public health in general and being a public health professional. Being in higher ed admin is like a great little field that I've been able to find where I'm able to still stay current with many aspects of public health by talking to our community partners, but also engaged in an administrative role. So on a day-to-day basis, I might have, for example, 3 meetings with community partners. So our students might, I might have a student who's interested in maternal child health. So I'll meet with, maybe someone who's doing work of that nature at a local hospital. Then I might have a student who's interested in substance abuse prevention. So I'll have a meeting with a community partner. So it's really neat to be able to stay, up and current with new research, new programs that are going on. And it's been kind of interesting with COVID happening because normally our students stay local to complete their internships, but because of COVID and most things being remote, our students have actually been able to have internships out of, University of Michigan, or they might have a nonprofit they're working with in, Washington State. And because they can complete it remotely, we're able to kind of have longer tendrils and more of a greater reach. in public health. So organizations, I'm meeting with 7 to talk about what they want to do for an internship in the spring. We go over kind of policies and procedures for the internship placement process. We talk about what their personal interests are in the field of public health. Where do they want to be in 5 years? What do they think their strengths are? And what might be a good match for them moving forward with internship and then professionally post-graduation. It's I really enjoy it. I think that, John was saying, like, he feels like medical device sales is, kind of a little niche field. I love medical device sales. I think it's great. So I'm so glad he's on the panel. And I feel the same way about my field as well. Usually people think of public health as, working at a health department or doing health education, but there's so many other aspects that you can get involved with, such as higher ed administration.
Stephanie, it looks like I actually have a question that came in specifically for you.
Okay.
One student asked, as someone managing undergraduate public health internship programs and having had many internships during your college years, what recommendations do you have for undergrads in finding and getting internships?
So like my number one piece of advice I tell everyone, all of my students, and actually it was mentioned earlier by one of the other panelists, is like, be brave, be courageous. Don't feel scared to talk to like your professors or, someone in administration at Gordon, or, reach out, do a Google search. If you think you're interested in public health and you think you're interested in, maternal and child health, figure out who's doing that work in an area geographically that you want to get involved in, or maybe even not geographically, just someone who has some knowledge and reach you think, and just say, hey, I found your name in like a Philadelphia Inquirer article. Someone interviewed you about food insecurity, and I thought what you had to say is really interesting, and I'd love to, hop on Zoom and pick your brain. So many people are talking about where they've been, how they got there, giving you some advice, getting you connected with someone else who might be a more appropriate professional contact. So it's kind of awkward at first, I tell my students, but really, if there's someone who you feel like might be a person who has some sort of knowledge that, or a connection
Stephanie, I think you're cutting out a good bit now.
To you or interesting, reach out. They're probably gonna respond. And I love that career. Oh, okay.
Thanks.
Amy, I was thinking maybe I can add to that, or like might be helpful. So like, I guess what Stephanie was trying to say is like, just be bold, don't put yourself out there. And I know a lot of people tell you that, and literally it's true. Like, awkward is not a vocabulary that exists in my life. Like, there's no such thing as awkward. Like, you want something and you go and get it. Like, that's it. There's no other excuses or whatever. And if you find someone that, if you have an internship in mind and you reach out to them, obviously write a nice email and ask for a phone conversation or a meeting face-to-face or whatever. Attach your CV all the time, just so they have a glimpse of like, what have you done so far, so they can know a little bit about you. But if they don't respond, always follow up. Like a week later, be like, hey, I just wanted to follow up. And most people, like, they're busy, they're not mean, they don't mean to ignore you, but you have to also realize that you're not the only one asking for these opportunities, especially if they're good opportunities. So it's like, you really got to put yourself out there. So like, I can give examples from my life. After I graduated from Gordon, I could not find a job. So it took me like 6 months to find a job at Dana-Farber. And my impression was, I just wanted to do an internship so that I can go to medical school. I wasn't even looking for like a job. And I reached out to this woman at Dana-Farber, whom I heard about from another person, and she never responded. So I followed up with her and she never responds. And so I called her, she doesn't answer. So I left her a voicemail. It sounds really bad when I'm talking about it, but it's like, when it's happening, it's really not that bad. So I called her And I was like, hey, I emailed you a couple of times, you never responded. I just wanted to like follow up. I'm really interested in working here. I think this is a good place, blah, blah. She never responded. So I was like, okay, I guess we're gonna pay her a visit. So I found out to where she worked, like her office, and I went. And she was like, oh, how can I help you? And then when I said my name, she was like, what? You showed up on my door? And I was like, yes, you know what I mean? Like, this is Dana-Farber, and not a lot of people are out there looking for opportunities to give you. You really need to go and get it. She was so impressed by me. She was like, oh my God, please have a seat. You have my attention now. And how can I help you? So that's when I was talking to her, she was like, you do not need an internship. You need a job. So that's when I was like, oh, that's interesting. I didn't even think about that. So that's when I started to apply for jobs and everything. And actually, I ended up getting my job through Dr. Story, who was one of your professors, introduced me with someone, and I got like my interview right there. So you really want to work your connections, but at the same time, just don't be afraid to be like, hey, I know what I want, and I know I'm qualified for it. I am disciplined. I will work hard. So give me the chance. So definitely, I think that's what Stephanie was trying to get across. Basically, don't be intimidated by people. Um, Definitely go and get it. It just really depends on how much you want it. And the other thing I wanted to say was like, so if there are no opportunities, create opportunities. Like sometimes, like for example, my sophomore year, I saw that there was so many mission trips that were going outside from Gordon, but there was none that was going to Ethiopia, and there was none that was going for a medical mission trip. So then I thought, why not? Like, why are we not sending anyone on mission trips for medical? So that's when I spoke with Dr. Carmer, and then they were like, oh yeah, like we didn't think about that. And I was like, well, let's think about it. So I'm not asking you to go to drastic stuff, but even if it's in a small scale, just care about something and don't be afraid to be the first one to do it. That only shows that you have initiative and you can follow through. So that's my advice.
Well said. Well said. I've got a few more questions that have come in too. Joanna, I'm wondering if I can send this one to you. What do you see as some of the biggest changes in the healthcare system in the past few years? And as we go into the healthcare field, what are some things we really should be paying attention to?
I just have to say, I love this question. I was actually just typing an answer just to make sure that person's question got answered, because it's such a great question to ask. So thank you, Lindsay, for that question. For me, I think it's the rapid advancement of technology in the healthcare sector. That has been a major change agent over the last couple of years, specifically around self-service options for patients and virtual access to care. So that's just the world that I live in. So I'm coming at it from that perspective. But I would say trying to figure out how to bring self-service options that are prevalent in almost every other industry. You can book a hair appointment now online. Like you should be able to book an appointment online. All of these things that the market is demanding and our patients are demanding is really, really hard to do in an institution as complex as Boston Children's Hospital, and I would imagine other large healthcare corporations. So for me, something to consider and to think about is always being ready to both reinvent yourself and reinvent the options that are available, and to make sure that you're doing everything that you can if you're in an administrative role or even a clinical role to support the advancement of technology. The other question, what are some things we should really be paying attention to, is what are your stakeholders' needs? When I joined Boston Children's 15 years ago, it was very physician-centric, and the hospital has drastically changed its approach and its mission to be more patient-centric and really focusing on the needs of the patient. So you might have a really, really great idea that could be abysmal for a patient experience. So always keeping, prioritizing who are your most important stakeholders and trying to make decisions and lead change based on those stakeholders. I think it would serve people well. And that means constantly adapting to an ever-changing environment. I'll also add, just to get a little bit technical, the ever-changing insurance industry. Insurance is changing every single day. So we have to keep very closely connected and paying attention to what insurance companies are willing to contract with us, are willing to work with us, others that are more difficult. The Medicare, Medicaid world is very, very difficult to navigate right now. So being mindful about that, especially if you're doing any kind of public health work, is really, really important right now, because it will be very impactful. And it will help determine who ends up getting care, and the goal is that for everyone to have equal care at the end of the day.
Thanks, Joanna. Thanks for answering that good question that came in. John, I have a specific question for you that came in too. One of our students would love to hear a little bit more of exactly what do you do on a day-to-day basis? And then what's your role when you're in the OR?
So I get this question all the time. Even after over 10 years, my family still asks me this question because, like I said, it is a completely hidden world of medical device sales. I mean, I had no idea about it. I only knew about pharmaceutical sales. You know, some of my friends were doing it, and honestly, just what I had seen in movies. You know, showing up at a doctor's office with a bunch of samples and, like, who knows? So medical device sales, you have whatever company you work for, you have a portfolio of products. With that comes a call point of surgeons. Like I said, right now I primarily deal with orthopedics, but there are numerous jobs across all different specialties of neuro, gynecology, general surgery. I mean, they all have their own kind of companies kind of geared towards some of those products. So my job, again, is to drive business, drive sales within that. So, but on a day-to-day basis, if I know I have surgeries with XYZ doctor, my job is to show up that day, usually an hour to an hour and a half early, make sure all the implants are there, are accounted for, are not damaged. We have everything we could possibly need ready to go for that surgery. Sometimes it's one, sometimes it's 6 or 7 surgeries. So to make sure enough equipment is there. Once the surgery starts, most of my role is to make sure the staff in the room are set up, ready for whatever instrument the surgeon is going to be looking for next. OR time is very expensive, as I'm sure Joanna could tell you. So everyone likes to obviously move as efficiently as possible, but every extra minute you spend in the OR is more money for the patient, the insurance company, the hospital, everyone involved. So my job is just to help kind of expedite things, make sure instruments that are requested are in line, ready to go. If the surgeon has a question, again, as Joanna said, technology is rapidly changing on all fronts, including in devices and implants going into our bodies that surgeons are using to help fix things. So my job, if a surgeon has a question on something, is to answer that question, whether it's on the surgical technique, informational question kind of on like a spec of the product, sizing, lots of different things. I really tell it, my job is to add value to that OR. It's really easy to get focused on the sales aspect, which is really not where you want to be. I had some really good mentors early on, and it's really ultimately about that patient on the table. So my job is just to make sure the surgery goes as well as it possibly can. And sometimes that's even been facilitating the use of another company's products. And that's kind of what I do. It's more my motto, my way of selling is to build relationship, keep trust going, and really provide solutions where I think it can make a difference for the surgeon, for the patient, for the hospital, everyone involved.
Thank you, John. That's really helpful. I learn something new every day. I see we have a few more questions that have come in, and I'm not ignoring anyone, I promise, but two of them are really similar. So I'd love to throw this to the group, and maybe whomever would like to tackle it, maybe just raise your hand. So I have two different questions that are specifically about internships. So even more information was, just are companies and organizations even looking for college students at this time despite Corona? One particular student lost an internship in March and wondering if there's maybe a little bit more encouragement in the field right now. Obviously, these folks talking from an undergraduate level, is healthcare even interested in that right now? So maybe a hand if you'd like to tackle the response to that.
I'm happy to tackle that quickly,
Thank
at least
you.
from the operations part of the house. So I do think we were in a critical state where at the beginning of COVID, where we were really trying to keep our staff and patients safe, which meant keeping as many people home as possible. And it is very unfortunate that I know that people lost opportunities in internships, and even the medical students, as was discussed earlier, were kind of sent home. Any person coming in the door posed a risk to themselves, to the patients that had to be there, as well as the providers that had to be there. As John said, it's kind of crazy. In neurosurgery, we had the best month financially in June than we've ever had, because surgeries are still happening, surgeons are still coming in, patients are still coming in. And so our job was really to try to keep the number of in-person staff and personnel to a minimum, and while having the right people in-house as possible. So unfortunately that meant sending home a lot of people who were there on a volunteer or internship basis. I will say two things. Number one, I do see that, at least for Boston Children's, we are starting to open back up a bit, get more comfortable. We have protocols in place now. PPE is not as big of an issue as it was at the beginning of COVID. I think we have it well managed. So I do think in this next up and coming year, you will see an influx of those internship opportunities happen again. Also, I would say that there's always an opportunity to do some kind of virtual internship. I also wear a different hat for the hospital, where I'm leading some hospital-wide initiatives around what I've been speaking about today around the technology. And there's so much happening in the digital space. And there's like a legion of interns over in what we call IDHA, our Innovation and Health Digital Acceleration Group. So even if it's not a clinical internship where you're getting to see patients and interacting with physicians, if you're looking for some kind of healthcare internship, there's a lot going on in that space. So I might suggest just broadening your search a little bit, because you might find that there are some opportunities popping up that don't require you to be there in person if it's not a clinical internship that you're seeking. And also a lot of project management opportunities now that someone like myself or someone in a digital world would love to have an extra set of eyes or a different person working on it, because right now so many of us are wearing multiple different hats, that projects are falling by the wayside. So to be able to have an intern that was helping us with the project would be really invaluable at this moment in time. So a little bit of encourage there, I would say. Don't lose hope. Things are starting, although we're all preparing for the second wave that hopefully won't happen, but we're getting better at managing the influx of patients and personnel. And then also just be creative. I love the suggestions earlier, be your own advocate. Send an email, it's not gonna hurt you. No one's gonna be upset. Don't send it high priority. We did have one student do that to our chief of neurosurgery, and he was not happy about that, because usually when you send an email high priority, it's for a clinical matter. And so don't do that, and give people time to respond, because they are definitely working 80 hours a week doing multiple things. But a polite email to just say, I'm looking for any opportunities that you might have. Sometimes going right to the top is probably not the best, because people are really busy, so a neurosurgeon in chief might not be the best, but if you have any kind of connection or even with HR, there's a lot of opportunities. Just broaden that search a little bit more, and definitely look in that digital space, because I think that there's some opportunities in healthcare technology.
Awesome. Anybody else want to mention their experiences with internships? And I know we just have a couple more minutes.
I would just say Joanna did a good job, from, you know, someone who manages internships. And to the student who lost their internship in March, I'm very sorry. That was the height of it. Many of our students lost their placements in March, and I had to replace them, but I have 60 students to place in spring, and I'm very confident all will be placed. So hopefully they will too.
Awesome. Dooney, were you going to mention something?
Yeah, and I was gonna say that I'm sort of in the same boat as you guys, because, you know, when you're in medical school, you still have to apply for internships and do all these CV building for residency. So it's the same thing. I guess one thing I would say, what Joanna said, is like right now, people in her role especially are looking for ways to improve their processes. And I think this is something you can do virtually. You do not need to be there to do that. So you can always reach out and ask, hey, like, I'm interested in this, can I help? And, you know, you just want something to show, and some stories to tell when you're applying for jobs, and they're not asking you to solve the world's problems. You just need to be a part of something that you cared about. And so it doesn't matter how little, like, don't underestimate opportunities.
Thank you.
Can I just say one more thing too that just came to mind? So I did an internship for social work at Gordon in undergrad, and I was determined to get an internship at Boston Children's. That's where I wanted to go. I knew I wanted to work there, and I was very disappointed when no one would get back to me and I couldn't make that work. And I ended up getting a local internship in Danvers at the Hunt Center for social work. And I was disappointed at first because it wasn't the big name that I wanted to put on my resume. But I have to say, it was such an incredible hands-on experience that I would not have gotten in a large institution such as Children's. So also, don't undervalue the local opportunities that you might have for a smaller business. There's so many healthcare businesses in the Cummings Center and others where they might love and not have a whole lot of funding to have, you know, multiple interns. So they might actually be desperate for someone right now to help out a little bit. But don't get discouraged if it's not the big name that you might be hoping for, because I would say you might actually have a better, more robust experience in a smaller, more local place than you would one of the larger Boston institutions. So as someone who went through that process myself and was so happy in the end with how it worked out, don't lose hope if you're emailing large institutions or people that work there and not getting anything back. Maybe scale back a little bit and look a little bit more locally at what those opportunities might be. You might find something really, really great where you'd have a lot more ownership over your project. So just wanted to add that too, in terms of I know that there were a lot of questions about internships. So another just tip as you're looking for opportunities.
Thank you so much. So I want to just say thank you so much to our panelists. You guys are amazing. I feel like we could go for another hour. There's such good information from each of you, and I probably got through like even 2 of my questions. So just thank you guys so much. I want to encourage our students. I heard CV or resume probably 100 times over the course of this. So I just want to really encourage students, please utilize our colleagues in the Career and Connection Institute. This is what they do for a living. So we have wonderful ways for your resumes to get reviewed. Please plan in advance. These aren't things that happen sort of like you bring your resume in overnight, it's done, but please plan. And I know that they would love to look at that, to give feedback, to meet with you, to help through that process. I also know, I hope these folks don't get totally inundated, but I also know all 4 of these folks are on LinkedIn. So feel free, use that LinkedIn profile that we have encouraged you at Gordon to make sure is developed, and you know, send a connection, send a message to each of these folks to continue to broaden your own network and connection. And I also do know that I believe Lily ask one more question for Dooney. And Dooney, if I can follow up with you afterwards to connect you with one of our students who had a specific connection to you, that would be really wonderful. So again, just thanks for the students for tuning in, and thanks to Joanna and Dooney and John and Stephanie for all of your really good advice and mentorship throughout this hour. We really appreciate it here and you giving back to Gordon.
Happy to be here. Thanks.
Awesome. Thank you. Well, have a good night, everybody. And hopefully we'll see you all again soon.
Bye.
Bye.
Take care.